On the first Monday of May, Jefferson County confirmed that it is now at the highest risk for COVID transmission, according to the CDC. This is following an uptick in the county's COVID infection rate over the past couple weeks.
Just a couple of weeks ago, we were really going in the right direction. We had got it down to 1.9%, and that's based on the number of people who are positive versus the testing pool of that day. And that was the last of that. Ever since then, it's been ticking upward. Yesterday, we hit 2.5% infection rate, and that has increased our transmission risk. That's why the CDC has reclassified us to the highest level.
The transmission risk, now in the red, is ultimately impacting the concept of herd immunity.
We're nowhere near herd immunity, and that's why I think our numbers are going in the wrong direction in terms of infection rate. We have to get more people vaccinated. And so we're going to be working very aggressively to try to meet people in a different way to get vaccinated. And we're also opening our vaccine clinics up to walk-ins.
According to Jennings, during the first few days of May, 93% of all COVID-19 cases reported in the county were individuals under the age of 50 years old. This group is now who the county is targeting to get vaccinated.
At the onset, we knew what our difficulty was at the start of this process, and that was going to be mobilizing the senior citizen population during the winter time. And the second half of this process, which we are now beginning, is really trying to mobilize and energize people who are reluctant, have hesitancy, maybe just apathy towards the process, and whatever the variety of issues are. And we're trying to mobilize and energize that population, that segment.
To allow for further flexibility, the Jefferson County Public Health Service is taking their clinics on the road, essentially bringing them to residents' backyards at local schools, fire departments, and more.
We're moving away from the JCC site. We're going to be going out on the road into communities directly, offering vaccine at locations that are familiar to people. We're going to be offering some evening clinics so that it's easier for people. If that's a barrier for people, particularly younger people, working people, to get vaccinated.
Chairman Gray confirmed that the single-dose Johnson & Johnson vaccine will most likely be available at all pop-up clinics, as well as doses of both the Pfizer and Moderna vaccine. Both Gray and Jennings ended by urging all to get vaccinated as the North Country is approaching a busy tourist season.
The other thing we're starting to hear this week is workplaces are being impacted. Sometimes all staff have not been vaccinated, or some of the staff have not been vaccinated. People who keep our economy going have an opportunity to help us, and in really encouraging their employees to get vaccinated themselves and encourage their employees to get vaccinated.
We have to get the numbers up a little higher so we can blunt the spread, because what we're seeing is that there's a rush to get back to that lifestyle, and we're picking up numbers in undesirable age groups. It's going to be important for our upcoming summer tourism season too.
For all listings of pop-up COVID-19 vaccination clinics in Jefferson County, visit the county's website. For ABC 50 Now in Watertown, I'm Isabella Colello.